fully recover from spine and joint arthritis, that is spinal, that is your back and neck, and your joints arthritis. Now, usually when we get this diagnosis of arthritis, whether it is anywhere in your body, say your wrist or shoulder or knees, these are the common ones, or in your spine, it can be quite overwhelming. And one of the first questions that comes to mind is whether you will ever recover from arthritis completely or not. Well, there is no full cure for arthritis. So, but then there's also hope, because there are quite a few things that you can do to manage your arthritis so that it does not flare up further. Now, before we jump into the topic, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back, neck, and joint pains. Now, as moms, we are busy people, and usually we don't have a big chunk of time to take out for ourselves to manage these aches and pains. So, this is where I come in and I help you with some simple exercises, easy lifestyle changes, hacks, tips, tricks, etc. Really the whole bag of things, which is easy to implement and does not take away a big chunk of your time from work or from your family and kids. Now, going back into the topic for today, can you fully recover from arthritis? Now, sadly, the answer is no, because though our bodies are they have very good healing powers, and when they're given the right nutrition and exercise plus other factors that contribute to healing in the body. However, though our body can heal very well, they are still very delicate. And usually, when you have such changes, age related or arthritic changes, usually this degenerative changes cannot go back 100%. Maybe you can recover 98, 99%, but that little tiny bit of change always remains. Now, how much symptoms does it cause, and how much pain does it cause is very individual. However, let's go back to the topic of can you fully recover from arthritis. So, as I've answered this question, but I will then now give you further tips of what you can do and why these things can help you manage your arthritis. Now, so basically, exercises. Now, usually when we have arthritis, or if you've had arthritis for many years and you have a chronic pain because of arthritis, the very first thing we think is exercise is going to hurt our joints. But you don't have to go to a gym and lift like heavy weights. Your exercise can be simple, uh, walking in the pool, if that's what suits you, or yoga or tai chi, or some gentler form of exercises. And if you have been doing those heavy exercises in the gym, then you can start with a little lighter load and then gradually build up towards what your aim for exercise is. So, what happens with exercise is when you are exercising, the muscles around your joints get stronger. So when they are stronger, they can support your joint better. And obviously, the when the joint has a good support, there will be less pain, less symptoms in that area, right, in that joint or the spine. Another thing that happens is usually with arthritis. Now, if you're looking at, say, the knee joint, which is a very common site for arthritis. So, if you're looking at the knee joint, usually the cartilage, that is the covering on the joint, is what gets worn out due to knee osteoarthritis. So, what happens is this cartilage gets worn out, and then the bones are rubbing on top of each other. That creates pain. When you exercise, there is influx of nutritive fluid, basically the joint fluid, in that area where the cartilage is worn out. Now, the cartilage does not have a blood supply, it does not have the nutrition from that blood. So this joint fluid is what gives nutrition to your cartilage. So you can actually help your joint cartilage by doing exercises, by getting that joint fluid to reach the cartilage. Now, just looking at my notes here, yeah. So another thing is your core exercises. Now, core, if you want to know more about the core, I have done quite a few videos and some basic ones as to what is core or what are core exercises. You can go to my YouTube channel and have a look there, or you can go to YouTube, type my name followed by core. So you can write Swati Prakash and core, and those videos will come up. But basically, core are the deepest layer of muscles that are present on a joint. Again, these are like a scaffolding around a building. Once you build up your core muscles, you will be stabilizing, because that's what their function is. You will be stabilizing the joints well. Once you stabilize the joints, obviously there's less chances of progression of your arthritis. Nobody can say for sure, but these are the things that you can do, and these are all the reasons why you should be doing the exercises. Of course, there are many other reasons, less stress and happy hormones and all that, but we are talking specifically for arthritis in this video. Now, the other thing is, you should know what aggravates your pain or aggravates your symptoms, and what relieves your symptoms. For example, if I do a repetitive activity like bending over, my back pain flares up. So I try not to bend over from my back, but I actually squat down if I have to pick up something from the floor. So that's just an example. It may be different for you depending on where your arthritis is and what your aggravating activity is. So know what aggravates your pain and your arthritis and what relieves it. And then, keeping those factors in mind, make sure that when your arthritis pain flares up, you take rest, especially from those aggravating activities. And when you're having, say, a good day, or your arthritis pain is not so bad, or your symptoms are not so bad, that is when you can sort of push yourself a little bit with your daily activities or your exercises. All right. Now, the other thing is, splints and braces, so external support. And now, when we were talking about strengthening your muscles, I did refer to the muscles supporting the joint, because they are covering the joint. And if they are strong, they will be able to support the joint better. Now, if you have weaker muscles or you need additional help, you can use a brace or a splint. Now, for example, a lumbar belt. If I have low back pain, or if I know I'm going to be traveling, I might be on a road trip and my back pain might flare up, I can carry my my lumbar support belt or my back belt with me. And if needed, I can use it, right? So that is another thing. There are neck collars, soft neck collars, there are lumbar support belts. There are, if it's your wrist, then there are some wrist braces or splints, the soft ones that you can use. Now, so these are the three things. And there is one more which we all know about, but then it's difficult to achieve, which is weight loss. The more the weight of your body, the more are the stresses on your joints and spine, because it has to carry that weight around. So if you are over the weight for your given age and height, try and lose a little bit of that weight. I know it's easier said than done, but I have seen it myself, because I have lost a little bit of little bit of weight. And I could feel the difference in my knees, because I have a bit of degeneration in my knees that started quite early on when I was younger. So I have to make sure that I lose weight in order to not let the degeneration go on and on. So I have actually started a program in which I do my exercises, because I know which exercises I need to do for my knees. So I'm doing these exercises, and I follow a healthy diet. I do not calorie count, I do not deprive myself. I'm eating everything that I need to. And I take this supplement that is basically an anti inflammatory juice that I'm taking. And it has helped my knees substantially. So, for example, I could not do more than half squats, and now I can do deep squats. So, if you are interested in knowing about this program, or if you have any questions or comments about this video, please do drop them into the comments below, and I'll pick it up from there. I will leave a link to this Jumpstart, this program that I had done. And if it helps you, why not? It's a good thing, right? You're not taking anything artificial. It's all natural, plant-based, no artificial fragrances, colors, and etc., etc. Basically, no junk in there. So I will leave a link in the description of this video. And I'll do the same for those of you watching me on Instagram as well. Alrighty, I hope this was useful. So if you have arthritis and you've been wondering about this question about recovery from arthritis, so hopefully I've answered the questions for you.